Well, ask almost anyone and they'll tell you that they're feeling pretty tired these days. It's one of the most common reasons for visiting the doctor. To look at the causes and when you should take fatigue more seriously is our resident Dr. Frances Pitsillis. Good morning, Dr. Frances. Nice to see you.
Nice to see you, Carly.
What is fatigue rather than just being tired?
Well, the definition of fatigue is that it's extreme tiredness resulting from mental or physical exertion or stress. So that's a general um, definition. And chronic fatigue is where you've had fatigue for 6 months and it doesn't recover from rest. And the doctors have found no cause. Now, it's really quite common. 20% of people between 45 and 86 complain of fatigue, and it's a very common problem. I think younger people don't get it as much. But, you know, people describe fatigue in different ways. I think a normal type of fatigue would be that you're tired at the end of a decent working day. But people will come to the doctor and say things like, I'm tired when I wake up, I feel like I haven't had any sleep. Or I come alive at night and then I can't go to sleep. Now that collection is due to people being generally depleted. It's often chronic stress, lifestyle, a combination of things, nutritional. But another thing about fatigue is that if you're experiencing random episodes of fatigue, you've got to then start to think, this is not right, this is bizarre. I'm okay for a day or two, or, I get episode. So that can be due to abnormal breathing that people don't know they're doing.
Okay, Dr. Francis, I just want to ask you something further on chronic fatigue because I've heard of friends and associates, acquaintances that have been diagnosed with chronic fatigue. They can't get out of bed and things. For someone that hasn't perhaps experienced chronic fatigue, it may not sound like much of an illness, but it is, right?
It is an awful condition, and typically they actually have difficulty going to sleep. They wake up unrefreshed, and in these people, you need to look for hidden causes of fatigue, which we're going to talk about today. And there are often multiple level deficiencies in these people that normal testing and examination doesn't pick up.
Okay, so we go to the doctor, we tell them that we're tired because of X, Y, Z. What would the doctor then be looking for?
Well, the doctor knows you, hopefully. This is your family doctor, so your family doctor knows you. And obviously, the doctor wants to know that you're not deficient in something like iron or thyroid or B vitamins. But the other things to look for is vitamin D and magnesium. People don't often think of that. And with magnesium, it's leg cramp, ringing in the ears, twitching eye. But the doctor also wants to know that there aren't any serious medical conditions going on like cancer, heart disease, diabetes, kidney failure, chronic diseases, including autoimmune, hormone, endocrine problems, mental health in the background that we're not picking up, and infections.
Gee, so feeling tired could actually hide a pretty serious disease, and you're going to really require your GP to dig a little deeper.
Yes, and I think that if the GP says, well, these tests are fine, just get more sleep or whatever, I think you've just got to have go back, because the consultations are not very long. You've got to go back and you've got to uh, discuss it again, I think, especially if it's new or if it's just not like you.
So, Dr. Francis, are there any hidden or hard to identify conditions that could be causing this fatigue?
Yes, there are, and I want to mention as many as I could think of today. One of them I've already mentioned, and that's disordered breathing. People breathe with their upper chest or a little bit too fast, and people should look up hyperventilation to see if they've got those symptoms. People who are often had a period of stress can develop this. Now, another thing that's important is obstructive sleep apnea. These people may not even know they've got it, especially if they're living alone. You can fall asleep at the wheel, or you just fall asleep during the day. So just be aware of that. Now, there are often stealth or hidden causes that could be part of this chronic fatigue thing. So someone who's used to looking for these is going to look for infections, chemical or heavy metal poisoning, looking at your occupation, and maybe even there are some people being affected by electromagnetic radiation these days. Hormones, cancer, very important.
Well, like everything we talk about with you, it's multifaceted. Often you have to look at so many different streams of your life. So what about lifestyle? How does that contribute to fatigue?
Very fundamental, Carly. And of course, I wanted to make sure that the important things were not missed. But often it is mainly lifestyle. It's, are you getting enough sleep? Are you getting 7 to 9 hours at night? And are you in bed by 10:30? Are you getting enough exercise? If you don't, you get tired. Look at your diet. Is there enough protein and not too much sugar and starch? Now, believe it or not, overwork causes fatigue, and so does drug and alcohol abuse. So really, we have had a stressful year this year, and people are tired, and I think quietly just chipping away and cleaning up your lifestyle could be all you need to do.
Oh, that is such good advice and could be a good project for the coming weeks. What about stress? You briefly mentioned that, but that can play a massive part, can't it?
Well, look, we've got a lot of unemployed people, unemployment, financial worries, bereavement, relationship problems, and stress at work or bullying. Think of anything that causes stress that you can think of, and that can make you tired.
So before we make an appointment to go and see our hard-working GP and part with some of our hard-won cash, what should we do before we go and complain of our tiredness?
Well, I think if it's crept up on you, you should take stock of your lifestyle, your diet, your sleep. Are you getting enough? All those usual lifestyle factors. If it's pretty quick and sudden and you've lost weight or you've got other symptoms, you definitely need to write these down and report them to your doctor.
And then what will our doctor do? What should we expect from them?
I think a good doctor who knows you will listen to all of your symptoms and be thinking of all of these areas. The doctor will do blood tests, and the doctor will want to make sure there's no serious things going on, given what they know about you and your own family history. And then together with you, your family doctor will work out where to go next when all of this has been done.
Okay, but for a general part of the population, this could be lifestyle, right? Do you have any final thoughts on that?
Well, I think it often is lifestyle and bad living. So think about that now. We've had a pretty difficult year. I think, start cleaning up everything. But it's always important not to miss serious health conditions.
Thank you so much, Dr. Francis, for your advice, as always.
Thanks, Carly.
And if you're concerned by anything we've discussed this morning, go and see your own health professional.